Hi, my name is David, President of South Africa Consulting. We are dedicated in offering the best and most efficient solution based on our client's situation. Recently, our organization has been working closely with the South African government with the goal of improving public health and reducing the burden of diseases. Public health refers to all organized measures to prevent disease, promote health, and prolong life among the population as a whole, whereas the burden of disease is a measurement of the gap between the current health of a population and an ideal scenario where everyone completes their full life expectancy and full health.
Based on our data collected from Statistics South Africa, 38.4% of the country's deaths are from communicable diseases. Communicable disease refers to the infectious diseases which spread from one person to another. 51.3% of the country's deaths are from non-communicable diseases. These are diseases that are non-infectious. And lastly, injuries account for 10.3% of the country's deaths. Our team had identified three main public health issues determined by the percentage of total deaths caused by the disease and daily rates of all age groups. Tuberculosis contributes to 8.8% of the total deaths and 1,042,700 years. Influenza and pneumonia at 5.2% and 1,210,700 years. And HIV/AIDS at 5.1% and 11,838,600 years. All three are communicable diseases. This means that these diseases are airborne viruses or bacteria which may also be spread through blood or bodily fluids.
Tuberculosis is an infectious bacterial disease that is characterized by the growth of nodules in the tissues. Tuberculosis is the most common cause of morbidity and mortality in individuals with HIV when infected. This disease is transmitted from one person to another. Those with tuberculosis will cough, sneeze, or spit the germs into the air, causing those who inhale the contaminated air to be infected with tuberculosis. Influenza and pneumonia is a virus infection which mainly affects the nose, throat, airways, and lungs. It can cause mild to severe illness and at times can lead to death. Our bodies are usually able to prevent these germs from entering our lungs, and however, the germs may overpower our immune system in other cases. Some other risk factors including drinking alcohol frequently, smoking, and having a weakened immune system, which can be caused by the two factors. HIV and AIDS is a virus that attacks the immune system. People with AIDS have a lower number of CD4 positive cells and can get deadly infections or cancers, which rarely occur in healthy people. One of the most prominent risk factors of HIV and AIDS include having unprotected sex without using condoms. This may lead the individual to contract STIs, which allow easier access for the HIV virus to enter our bodies. Anal sex can also put people at high risks as opposed to vaginal sex. Sex workers or individuals with several sex partners are at even higher risk, especially when the sex is unprotected.
After thorough research, we have come to the conclusion that HIV/AIDS is a main branch leading to tuberculosis and influenza and pneumonia. This is because HIV/AIDS weakens the immune system, allowing easier entry into the body for other viruses or bacteria. Therefore, the task at hand is to fight against HIV/AIDS.
So we have come up with the PACE plan to improve the health issues in South Africa. The PACE plan will use prevention, awareness, community, and expenditure as strategies to tackle and ultimately eliminate HIV/AIDS.
In terms of prevention, we plan to promote the use of condoms, male circumcision, and testing. This can be done by implementing a policy requiring South African residents to attend mandatory annual tests for HIV/AIDS and tuberculosis. Proactively performing tests is important because diagnosing HIV/AIDS is more effective during earlier stages of disease progression. Research has shown male circumcision has reduced HIV/AIDS risk by 60%. As a result, we will make circumcision mandatory for all newborns starting May 1st, 2016. We will also discourage sex trades by encouraging sex workers to work for the government as relief workers during the 10-year campaign.
As for awareness, it is essential to educate communities and families about the consequences, symptoms, and complications of HIV/AIDS. This is especially crucial for women and children as they are the most vulnerable. Raising awareness will help deal with our problem significantly. A promotional video contest will be held every beginning of the year to encourage families to learn more about healthy living and awareness towards diseases such as HIV/AIDS and tuberculosis. These videos will be voted by South African citizens. Furthermore, the top 5 videos will receive monetary prizes and will be broadcasted nationally for 1 year. We can also hold workshops on various health issues in schools across the country. Brochures and magazines regarding prevention of diseases will be handed out to households every month to raise more awareness.
Some HIV/AIDS patients are on waitlists for treatments or live far away from a public hospital. Therefore, developing community-based health facilities will bring the care they need closer to them. This can provide direct, local care and services. The government plays a great role, and they must reallocate their spending to make this plan successful. And necessary expenses will need to be cut down in order to achieve a better healthcare system, development of facilities, and education sources.